Welcome to the EAU podcast. In this History Office episode, Loek Keizer and Rob Schipper talk about the earliest developments in endoscopy and how they dovetail with the rise of urology as a field. Join us as we revisit the milestones, innovations, and individuals who have shaped modern urological practice.
Welcome, listeners, to another edition of the EAU podcast. Today we have a historical topic, and we will be discussing some of the earliest developments in endoscopy. My name is Loek Keizer. I work at the EAU Central Office in Arnhem, the Netherlands. Author of the EAU's 50th anniversary publication, and there's plenty of copies still available. I'm joined by EAU History Office curator and urologist Dr. Rob Schipper, based in Den Bosch, the Netherlands. And Rob is also a member of the History Office of the Dutch Urological Association. Rob, what are we talking about today?
We're talking about the early steps of endoscopy in Europe. But of course, urology was born for the main part in Europe. And the first real step was the first endoscope was invented by Philippe Boccini in 1804. So that's, let's say, more than 200 years ago. And Boccini was actually studied and worked in Mainz, now called Germany. And he served as a doctor in the Imperial Austrian Army. And he was in charge of a large field hospital in Mainz. And he experienced during his work how difficult it could be to find bullets in wounded soldiers. So he started to think, what can we do to make this work easier? And this inspired him to design an instrument. And he called this the lichtleiter. And it was an instrument with which you could see into the air, the urethra, the vagina, the rectum, the female bladder, and also look into wounds. It was built by an Austrian instrument maker, Johann Gottlieb Weissner. And it was working in Leipzig. And Boccini, however, never mentioned him, the builder of the instrument, in his medical publications. He presented this instrument in Austria, and he demonstrated it in 1804 for the first time in Frankfurt, and the reactions varied. His intention was ridiculed in a local newspaper. People thought it was a very stupid idea to look inside bodies, but there were also people positive. And he published about his instrument, the lichtleiter, 2 years later in a German medical journal. And the title of the publication was Lichtleiter, eine Erfindung zur Anschauung innerer Teile und Krankheiten. Or just to say, an invention to look inside the body and its diseases. It was actually a leather-covered instrument with a metal chimney. It was a 4-leaf speculum and a candle inside for the light. And with this mirror system, the light was guided through the instrument. And that spring mechanism made sure that the flame remained at a constant height, because you also always needed a very steady illumination. Boccini thought that the instrument maybe could be incorporated into Austrian military hospitals. And the Emperor of Austria at that moment, Francis I, he ordered to buy the lichtleiter and tested it whether it was suitable for practical use. Unfortunately, there was an investigative committee, and they subjected the instrument to various tests, starting with the examination of corpses of the bladder, the rectum, vaginal and peritoneal cavity through small laparotomy wounds. And then the committee proposed some changes intended to improve the performance of the light conductor, or the lichtleiter. And some changes were made. They were satisfied with the instrument, but only the examinations in the peritoneal cavity were not approved. So it was only allowed to use it in the rectum, vagina, and so on, but not in the peritoneal cavity, because the procedure needed to be painless, because there was no anesthesia at that time. But then there were a lot of intrigues in the governmental spheres, and there was a second expertise committee needed, and they decided to do it at the Vienna Medical School. And it's probably partly influenced by the church. The report that came out was unfavorable for Boccini, and it was concluded that such an instrument should not be used. So the Lichtleiter was never really used in practice. It was a very revolutionary instrument because today you could not think about urology without endoscopy. And this was actually the first instrument devised to do such kind of investigations. It was not very practical because it was very hot during use. It was very difficult to use. So from a practical point of view, it was probably not very handy, but the idea was okay. Boccini only was 36 years old when he died of typhoid fever. And it took about 40 to 50 years that another invention or another instrument was made by Desormeaux in Paris.
So, Rob, if we could place this invention in its time, the idea of getting light and vision into the human body was completely unheard of.
It was because you have to realize that at that moment, medicine was a science of, let's say, talking about diseases but not doing much because there was no anesthesia, there were no operations, there were only, let's say, bloodletting and small fracture treatments and amputations. That was it. Doctors, they reclaimed or proclaimed about the old Greek and Roman doctors. They just followed their ideas, and it was a totally different idea of looking inside the body that was not done before. So that was very revolutionary to think in that way, and also to make develop an instrument that was in its base capable of doing that. So that's the revolutionary part. It's another way of doing medicine, and it's one of the developments in the 19th century where you see the development from, let's say, an alpha science to a beta science, from let's say you have to be good in Latin and Greek to read the old doctors, to study, do laboratory tests, do X-rays. That's of course a little bit later, but this development suits in this big picture. And the Lichtleiter, Boccini, was actually one of the forerunners in this development.
Yeah, in fact, he was ahead of his time in that surgery was not quite ready to accommodate what they were looking at.
No, that's true, because they didn't have anesthesia. Every surgeon, the best surgeon was the quickest surgeon, and there was, when you could do an amputation in 3 minutes, then you were a good surgeon. You had, of course, no antibiotics. You had only some blood vessels and maybe do a little bit of blood clotting, but that was it. There were no big possibilities to do big operations. So this was really another way of thinking, and it fits in this development.
And we're also talking about a pre-electricity age. So all the lighting had to be done with a candle, and that produced warmth, and that also perhaps reduced the efficacy of this instrument.
Of course, and it was the warmth was one of the problems, but the other problem is that the light of a candle is very, very low. So if you compare to the today endoscopes, it's incomparable, because it was only let's say a very dark picture that he could have had when he would have looked with the instrument into the cavity, in the peritoneal cavity.
Right. So the instrument initially failed and was not adopted. However, there is a early 21st century coda to this story, right?
Yes, that's true, because After the Second World War, American soldiers, when they liberated Vienna, they found the instrument and took it with them to the States. And then it stayed there for decades. And then Manfred Skopek from one of the, he was probably the curator, but he was from the Nietzsche Leiter Museum in the Josephinum in Vienna. And he was one of the people who made it possible to exchange the original Lichtleiter for a copy made by Daimler-Benz. And then the exchange took place in 2002. So that's when the original Lichtleiter returned to Europe. And actually there's a picture of him proud walking to the Josephinum with this instrument. And if you want to see the instrument now, you can just visit the museum. It's a couple of years ago they decorated or reinstalled the museum. It's a very nice medical history museum in Vienna now in the Josephinum. You can visit it, and there you can see the Lichtleiter in its glory and look at it. And it's one of the major objects there. And if you know the story behind it, it's really nice to go there. Of course, Vienna is also a nice city to visit.
And as a urologist, you're looking there at the beginning of endoscopy.
Yeah, that's for sure. And you are there in the place where it all happened. So that's a very it's an important place. That's also the place where it was demonstrated. That's it's not obliged to go there, but if you have the time, you should go there.
Okay, I think then we move ahead a few decades.
Yeah, then we move to France because of course there were some countries very important in the development of urology, and France is of course one of those countries. And we're now going to talk about Antonin Jean Desormeaux, and he was chef de service at the well-known Hôpital Necker in Paris in 1853. And he also developed an instrument with an endoscope type of instrument with a long metal channel, in which the light was not from a candle but from a petroleum lamp, and this was also with a mirror system to reflect the light. It was actually a modified Lichtleiter, but he used it on patients. So he was the first to use instruments on patients because the Lichtleiter was only tried on corpses. And he was also the first to use the term endoscopy. So this is also a very important development. So he used the instrument during diagnostic purposes, but also with therapeutic purposes as far as it was possible.
Is there a link between the two instruments? Was Desormeaux aware of the original Pothier?
That I don't know, but probably he was. If you look at the design, then it looks a little bit the same. I don't know that. Maybe somebody knows, and if anybody can tell me that, I would be pleased to know that. So probably he knew about the Lichtleiter. Then again, sometimes two people do the same, let's say, invention at nearly the same time, because it has also to do with the developments of technical developments in chemistry and physics. So, probably otherwise maybe somebody else would have invented it. It's something in a big picture, of course. This instrument also suffered from the same problem because the visualization was not good enough and it became very hot during use. And you have to keep in mind that it was used on patients, so that was a little bit dangerous. And that was also the limitation of the instrument. So it was not a big success, and he used it, but and that was it. It was only on a limited scale, and it was not used worldwide or with a lot of physicians at that moment during that time. So that was 1853.
I believe the German Society has an original in its collection.
Oh, that's a good question. If you say so, they will probably have. I did not see it yet, but that is probably then in Berlin at their exhibition.
I think so, yes. We have some photos and a short article about this Desimo endoscope on our museum website, which is from their collection, so I assume it's there.
Okay, now then there's also another spot you have to visit, of course, the collection of the German Society of Urology in Berlin. I was there. I was close to visit it, but then I didn't have the time, so I have to go there someday. But well, we see about that. I don't know how many instruments were made, so I really don't know. Maybe somebody can tell me that, and then again, I would be delighted to know this. If you allow me, I want to make a move a couple of years ahead, and then we go to a guy who probably everybody has heard of, Maximilian Nietzsche, a German physician from Dresden, because he was actually the godfather of the cystoscopy. And other instruments were developed where we talked about the Loek Keizer and the endoscope of Desimo, not only for the bladder, but the first cystoscope was developed by Nietzsche. And he was actually inspired by the work of Julius Bruck, a physician from Breslau, because he inserted an electrically heated water-cooled platinum wire into the rectum to eliminate the bladder. Again,
to illuminate.
He inserted an electro-heated water-cooled platinum wire into the rectum to eliminate the bladder. Do you have the picture? Probably this was not very, very safe, but he did it. And the elimination was, of course, insufficient. And Nietzsche realized that to light a room, the lamp had to be in it. And that's actually a very important sentence, because you cannot light a room if you switch on the light on the room next to you. It's not very clear in your room. So that's what Nietzsche was, the basic thought of Nietzsche. So he, of course, with probably the knowledge of the Desimo instrument and maybe also of the Lichtleiter, he started to develop a cystoscope together with Wilhelm Dijker. So not with another guy who will come on later on, but Wilhelm Dijker. He was an instrument maker from Dresden. And on the 2nd of October in 1877, they performed the first cystoscopy on the deceased person and showed a previously inserted bladder stone. So the bladder stone was not there, but it was there when they did the demonstration. And this first lighter cystoscope had a prism, and later model had a telescopic lens system. So this was the first practical cystoscope. So now it's this development's, let's say, 150 years old. That's what it is. Maybe we have to celebrate this next year in one way or the other.
And we are at the moment in the age of electricity. So the use of very small light bulbs is what...
But that's what Nietzsche used, but we come to that. The bladder was not... because at that moment there was no light bulb. It was... he used an electrical heated platinum wire. So the same Bruck used, but he put it in his instrument. And Nietzsche was not satisfied with the optical properties of his first cystoscope, so he contacted Joseph Leiter, and that's a very famous name. And he is actually, when you talk about Nietzsche cystoscope, it's always called Nietzsche Leiter cystoscope. He was a well-known Vienna's instrument maker, and he made improvements that Nietzsche wanted on the instrument, the original instrument. And then it could be used in a practical way. And they had to cool the instrument because it also became very hot because of the platinum wire, and they cooled it with circulating ice water, and that made it practical.
So just to paint a picture for our listeners, it's not a light bulb; it's more the filament inside the light bulb that is in the tip of this instrument. Yeah. So he's inserting the filament directly into the human body.
Yeah. And the filament is in the instrument, and that is electrical heated, and that gives light. And that is the first design of the Nietzsche Leiter cystoscope. And it was first demonstrated to the public in Vienna, so not in Dresden, but in Vienna in 1879. So that was the first development, but later on, and then we come to what you talked about, we had the invention of the light bulb. And that, of course, we have Thomas Edison, among other people, of course, to give credits to. And then when the light bulb became available, they had to make smaller light bulbs because the first ones was, of course, too big. And when you got the mignon lights, then you could use them in the instrument. But those are developments taken from the States, from two guys called Henry Koch and Charles Preston. And they developed the minion lamp, and that was a very small lamp with a low ampere, and it was small enough to fit on the tip of the cystoscope. And that gave better light. It gave actually very bad light compared to what we have now, but compared to the platinum wire, it was a revolution. Those bulbs were very fragile, had a short lifespan, and they became also very warm in the bladder, but not as warm as compared to this platinum wire. And the energy needed for this bulb was generated in a wooden transformer. And you had two models, one table model and one that could be worn by a urologist around the waist. So it was really some kind of a show. And the invention of the light bulb was actually also in 1879. So the same year that Nietzsche demonstrated his cystoscope was the same year that Edison invented the light bulb. And then after that came the mignon bulb. So that took a little bit of time. Actually, Nietzsche was not the first one to use a light bulb. That was David Newman, a famous urologist from Glasgow. And he was the first to use a light bulb in a cystoscope, and he did it in 1883. So, but that was a big instrument. It was too big to use in a man, so it could only be used in women. And if you see the size, then it's a little bit of a rude instrument, probably. But that was the first step in using light bulbs in cystoscopes.
Yeah, and these days when we talk about scopes, we talk about single use or cleaning them. But I wouldn't want to imagine what cleaning a scope without a light bulb and just a filament is like.
Yeah, but the cleaning is a whole other story. But you have to keep in mind that it's the same time that actually the bacteria the bacteria that caused specific diseases were found one after the other. So that's the time. It's the time of Pasteur and of Koch, and it was not the time of antibiotics, and a lot of people died, of course, of infection, not through cystoscopy, because that's not a very risky business. But if you did an operation or things like that, then it's a totally different story, of course. And the diseases were also different. If you look at where the operations are described, there are a lot of operations we do now every day that weren't done at that time. It was a different pattern of pathology, because prostate cancer, there were no prostate cancer operations. Okay, they did nephrectomies, but they did it mainly for infection, sometimes for tumors, but most of the time for infection. They did a lot of urethral surgery because you had, of course, gonorrhea as a main cause of stricture. So stricture disease was big. Bladder stones were big, so that not the bladder stones itself were big, but the problem was big. And so that was there were different types of operations at that time.
Yeah, we're talking about the 1880s, 1890s at the moment, but also very much when urology was first becoming its own specialization.
Yeah, it's actually around that time, at the end of the 19th century, beginning of the 20th century. And then it took into the 50s of the 20th century that it was really its own specialty, because before that, a lot of surgeons thought they could do everything. But it was the Dutch Society of the Dutch Urological Association is founded in 1908. So that's you can have an idea of what time that this development took place, but it was not until 36 in Holland that urology was a specific specialty.
And what would urology be without endoscopes like this?
Yeah, and you cannot imagine that. Of course, you can imagine it, and you can ask AI to help you with that. But it's a cornerstone. Endoscopy is a cornerstone in a diagnostic way, but also in a therapeutic way. So we could not have done our TRPs. We could not have done our cystoscopy for bladder cancer, for bladder stones. We could not have done stone surgery. We could not have done, maybe also because a lot of techniques from the cystoscopy and endoscopy, of course, are also used in laparoscopy. For example, the optics or the light conducting and the light development. So that are all developments that stick together. So urology without this development is practically unthinkable.
As we are now on the cusp between the 19th and 20th century, maybe it's a good time to end this talk, and we can cover the 20th century another time with a big name I see coming up, Harold Hopkins.
Yeah, that's also always good to have a cliffhanger. But Harold Hopkins and the development of the flexible instruments, that's another big story. And there are more guys involved, like George Bessie and of course Karl Storz. And that's a very nice story to talk about, but we can do that another time, of course.
Rob, thank you for your time this evening.
You're welcome. And if somebody from the European Association wants to have more information, wants to join us, wants to talk with us, or in another way is interested in medical history, don't hesitate to contact me or Loek or other members of the history committee. We're always glad to talk to you and talk about this fascinating story of the development of endoscopy and urology.
Yes, you can always send an email to info@euroweb.org.
Great. Thank you very much.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on the urological advancements, be sure to subscribe to our EAU podcast channel on your favourite podcast app. Until next time, keep learning and stay inspired.